Start us. There are people who've been on for about 10-15 minutes. We have very good turnout here. We have Dr. Cohn, our overall principal investigator of the University of California Global Health Institute and GloCal Fellowship Program. Kwana is from Kenya, Kisumu. Welcome. Kwema, we have Michael joining us also from Kenya, just finished his endoscopy work at the hospital. We have Juliet from Ghana. We have Catherine, who's now in Tanzania. We have Melissa, who's finished her fellowship, but now doing another postdoctoral activities at University of California, San Francisco. We have Gabenga, who is calling in from Cape Town. Colby Passaro. I'm not sure where you're from, Colby. Are you able to tell us?
I'm in Lima with Dr. Clark.
Ah, okay. Thank you. So from Lima, Peru, we have Claire Bristow. Claire, you're in San Diego now?
Yes, I am.
Okay. And I think that covers everyone so far this morning. So thank you all for joining. This is our first effort to talk about career. So your feedback on this is going to be very important, and everyone should be able to use the Zoom group chat if you have any questions. And as I'm giving the discussion today, you can bring up some questions on the chat. I think that's best. And my plan was today was to go over just a brief kind of biography of my background, and then go and just show you some documents that we use in the currency of global health research and research applications such as the biographical sketch and the curriculum vitae, or the CV, and at least the UCLA format of that. And then briefly talk about some different funding opportunities and how I'm funded. And then over the next year, I've invited different senior global health investigators, including Dr. Cohn, Dr. Reingold from UC Berkeley, and others who are also going to share their career trajectory and also share their funding sources over the years. And I think, listening to successful senior scientists about their journey can be very informative. I know it's very informative for me as a young investigator. So before I jump in, are there any current questions or logistical issues people are having with either seeing me, hearing me, or communicating? All right. Well, then also I want to introduce our global health career coordinator, who is also on the call, Pal Shah. Pal, you want to say hello, please?
Hello, everyone. If you have any difficulties during the entire, any technical difficulties, just let me know.
Thank you. And then over the course of the year, as you have additional questions or need additional resources or documentation or access to funding opportunities or PDFs of documents, I know sometimes it can be challenging to get access to certain links or documents. Pal and I will be happy to provide assistance. So you should use us as kind of your your helpers to try to navigate some of these issues. Okay, so I'm going to try to bring up the first slide. So share screen. And Paul, is this working?
It is. I see your slide.
All right. And is it like you can see the all the little details, or you just see the slide?
I see the details too.
All right. If I go like this, now what? Now you just see the slide?
Yes.
Okay. So this our first topic is just kind of a brief outline of my career biography. You can see I finished Cornell University with a degree in 1986, so over 30 years ago. I went to Cornell University Medical College. I took 5 years because I spent an additional year working in Kinshasa, Zaire, for Projet SIDA, which was an international AIDS project in Kinshasa, Zaire. And that's really where, as a medical student, I got, quote, bitten by the bug for global health. And from that 1 year experience, really was trying to think about what additional training I would need to become a global health researcher, become a global public health practitioner. And I was in that experience at Projet SIDA in Zaire, which was an international conglomeration of different organizations. The Institute of Tropical Medicine from Belgium, the NIH was funding research there, the CDC was doing investigations into the heterosexual transmission of HIV, and the WHO was just starting to think about how to develop a global program on AIDS. So realizing at that point I wanted to go into global public health, I needed to complete a residency in something fairly general. So that was internal medicine at the time, but I think people, Dr. Cohn has had a very successful pathway by being an OBGYN. People have done it with pediatric residencies. I think the more specialized, it does potentially become a little bit more difficult, but there's certainly highly effective ophthalmologists, general surgeons, specialty surgeons, etc. So that was a 3-year residency at NYU Bellevue Hospital, which at that time, in the early 1990s, it was the peak of the AIDS epidemic in New York City. So it was a very busy time taking care of some very sick young people in New York City. And, that was before we had highly effective antiretroviral therapy. So I was taking care of a lot of people who were dying. And because of that somewhat intense clinical experience, I needed to take a rest and kind of switch to academics a little bit. So I went to Harvard School of Public Health and did a 1-year master's in public health. And my mentor at that time was Jonathan Mann. And Jonathan Mann had been the first director of the WHO Global Program on AIDS, and also had started that project in Kinshasa, Zaire. So in some respect, I was kind of following him along. And during that year at Harvard School of Public Health, I focused on international health and epidemiology, and then also supported myself by moonlighting at a community hospital outside of Boston. But recognizing that the academic experience probably was not sufficient, I really wanted some field experience in applied epidemiology. And that's when I joined the US CDC Epidemic Intelligence Service in actually 1995. So I did that for 2 years, from 1995 to 1997. When you're a CDC, what we call EIS officer, you can be assigned to Atlanta. So about half of the persons are assigned to Atlanta, where they work in very narrow disease or pathogen-specific branches. So you can be in the rickettsial branch, you can be in the tuberculosis branch, you can be mycotic diseases overall. You can also be in adolescent health, and you can also be in more general surveillance. CDC is actually really wonderful, broad institution with a lot of different areas in health, public health, and also very deep. So they have some of the best laboratories in the world for studying specific pathogens and specific conditions. So about half of people are assigned to Atlanta, and then the other half are assigned to different states and major cities around the United States. And I was actually assigned to San Francisco. So people can be assigned to New York City, they can be assigned to Seattle, Los Angeles, Chicago, New Orleans, so major cities in the United States. I was assigned to San Francisco, and within the San Francisco Health Department, I was assigned to the STD Prevention and Control Program. Honestly, I was initially a little disappointed because I was very focused on HIV, and I didn't really fully understand how STDs were going to lead me to a career in HIV prevention. But when I got to San Francisco, I was really enlightened and started to see the synergies between STDs, gonorrhea, chlamydia, syphilis in particular, and HIV, and felt if one can learn how to control those conditions, which arguably there had been some success in controlling syphilis epidemics in the United States, continued transmission of gonorrhea. There were control programs for chlamydia underway. You could apply that to HIV. But having this interest in both STDs and HIV. Hello, Tariro. Welcome. How are you?
Fine, thank you. And yourself? I was having challenges logging in.
All right. Well, thank you. And you're logging in from where?
Yes, I'm logged in from Zimbabwe.
Zimbabwe. All right. So thank you very much. I'm just going to ask you to go on
Yes.
mute. And people can put up some questions during the presentation. And then also,
All right.
I'll take a pause here. So thank you. All right, Lynette, welcome. Lynette, you're calling in from where? Looks like she's still trying to get in. Lynette, can you hear me, Lynette?
Yes, I can hear you.
All right, you're calling in from where?
Sorry, I'm late in joining in. I'm calling from Kenya, Nairobi.
All right, welcome.
Thank you.
So I will continue in a minute. I just want to see, and if you can just go on mute, Lynette, please.
Okay.
Eliza?
Hello.
Hi, welcome, Eliza. You're calling in from where?
Hello, I'm calling from Peru.
Peru. All right, welcome. So,
Thank you.
All right, so people can put in comments or questions. For those latecomers, I'm just going to repeat that I'm starting off with this review of my bio, and then I'm going to go into some documents that we use, such as the Biosketch, curriculum vitae, and then talk about funding a bit. And then we'll have different speakers over the next year who will do similar, and you'll kind of learn from their trajectories and career journeys. And with your feedback, we'll be able to further kind of modify the type of career development support we do. Okay, so I was talking about my time with the U.S. Epidemic Intelligence Service with the CDC, assigned in San Francisco, Department of Public Health. And that was a fantastic opportunity to really learn field-based public health, be involved in outbreaks. I was involved in a mycoplasma pneumonia outbreak at a county hospital, a trichomonas vaginalis outbreak at a women's detention facility, outbreaks of gastroenteritis at nursing homes, and then an outbreak of drug-resistant gonorrhea in the Philippines. And the Epidemic Intelligence Service is really geared to people who are looking for a career in public health, not necessarily a career track of NIH or internationally funded research, but people who want to ultimately work for WHO, work for CDC, maybe work for their own country, Ministry of Health, but on a day-to-day public health basis. And I always say, if people want to become investment bankers, in the United States at least, they need to work for Goldman Sachs, which is the premier investment banking firm. If you want to work in public health as a health official, you really need to work at some point in your career for CDC. That said, I felt the U.S. Public Health Service and the CDC was a bit bureaucratic and slow. So then I left the CDC to go work for, or to do a fellowship in clinical infectious diseases at the University of Washington. I was actually at that time in the late 1990s when I met Craig Cohen, the PI of this overall program, and the ardent supporter of global health training and fellowships. And at University of Washington, my mentor was King Holmes, who is at the time was very well known for sexually transmitted diseases, epidemiology, microbiology, clinical trials, intervention studies, and was a senior author of the textbook STD. So from my time in San Francisco, I really understood I want to get deeper into STDs, and that's why I sought fellowship training at University of Washington. So I was up there for about a year, and then I got a call back from the San Francisco Department of Public Health, where I had done my EIS training, to come back to San Francisco to be actually a health official in the health department. But I was a fellow at the time and really was with my family in Seattle and did not want to move back to San Francisco. So I said no. Then they called me back about 3 months later and said, listen, we really think this position is good for you. We really would like you to come down to San Francisco. So that's an opportunity in your life when you're being recruited by a major institution where you have some ability to negotiate. And that's probably my kind of key learning point number one, is as a trained scientist, as a physician, epidemiologist, PhD, when you develop your expertise in an area, you become an asset. So you not only believe in yourself, but others believe in you, and you have value that you can bring to an organization. And when you're being recruited, that's an excellent time to negotiate. So there's lots of different kinds of things you can negotiate. It's not only negotiating about your salary, which is certainly the most common thing people can negotiate about, but you can negotiate about your office and your whereabouts, your location. You can negotiate about what kind of office support you may need or want, or what's available. You can negotiate about your timing of when you start. And for me, that was a big issue because they wanted me to start at that time in April. And I wasn't going to be able to be done with my fellowship until July. So we actually ended up negotiating a June start date. You can negotiate about your responsibilities. You can negotiate about the breadth of your work. So I wanted to still do global health and still do international research, but for a city health department, why would they want to support someone doing international research? It didn't necessarily make sense at the beginning, but if they want someone to be involved globally, and particularly around HIV and STDs, San Francisco wanted to maintain an international reputation. They realized that they needed to support someone who would be doing some international projects. You can also negotiate different additional activities. So I wanted to also a position at UCSF as an attending physician in the hospital, as a faculty member, be able to teach medical students, be able to attend on the wards. So none of these things often the recruiting institution is going to present to you. they're not going to say, would you like these other opportunities? They're going to have a very narrowly written job description. And you may think, well, I'm applying for this job on the job description that this is true, but you actually have the opportunity to think more broadly when you're in that negotiating position. And that negotiating position is going to occur after the interview and at the time when they make an offer. So any big institution, whether it be a university, a ministry, a health department, a private nonprofit, at some point you're going to get an offer. And it's when you have that offer, then you're in the position to negotiate. And it's reasonable when you're doing the interviews to, scope out and find out what kind of activities are ongoing, but you don't want to necessarily play your cards too early, and you don't want to give away the fact that you want to do international research, you want to travel, you want to be an attending, you want to be a faculty, you want, because then they may perceive you as, a needy person, or they may perceive you as, someone who's not a good fit for the job, right? So the number one reason people don't get jobs is because the recruiter institution declares, oh, they're not a good fit. And that can be, it can be a lot of different meanings to what that is, not a good fit. But sometimes it can just be that this person, it just thinks they're too big for this position, or even the opposite, that this person does not have the creativity, the initiative, the vision to bring our institution to the next level. So I was able to negotiate the faculty position, able to do international research, being the leader of a team, and the institution kept saying yes, yes, yes. And then I was at the point where, okay, I've gotten everything I've asked for. There's one more thing I want, and that was a parking space. And they said, well, we can't give you a parking space because you're not senior, you haven't even started yet, and parking space goes based on how long you've worked for that department. And I said, well, then, no deal. I can't take a job without a parking space. And then they came back to me the next day and offered me a parking space. And at that point, when you've received everything you asked for, you either have to take the job, or if you don't take the job, you may upset people by being demanding and negotiating, and then ultimately not taking the job. So you have to have a very good reason for not taking the job, because also in academics and public health and research, it's relatively small. So you do have to be concerned people can talk. And you always want to maintain a reputation of high integrity, honesty, transparency, responsiveness, because it's really your reputation that carries you forward in the field. And you want to be known as the person who's easy to work with, who's smart, who's responsive, who's timely. And the kiss of death sometimes in our field is being known as someone who's not easy to work with. So you can be brilliant, you can have the best ideas, do the best research, but if you're not easy to work with, it's going to be very difficult for you to be successful, to be invited to present at meetings, to be part of advisory boards or panels or groups and technical work groups. And in order to maintain your impact in public health or research, that's an important group of activities. So you have to always maintain your ability to be easy to work with. So I worked in San Francisco and at UCSF for about 11 or 12 years. And then I got to a point where I felt like I wasn't making additional progress or impact in San Francisco. We had implemented very good HIV prevention and control programs with rapid testing, strong linkage, early treatment. We had very good STD programs with lots of screening, partner services, and at least at the time in the mid-2000s, we're starting to see the beginnings of declines in HIV, declines in STDs, and I wanted to get back to more international and global health work. So I left the San Francisco Department of Public Health and joined the CDC. And it's not like you can just call the CDC and join, so you have to apply. And one of the major portals for applications is on a website called USA Jobs. I think that's what it's called. And we can send that out, that link. But this site called, let me just check that out. Shah, are you able to pull that up? Yeah, it's usajobs.gov. So on usajobs.gov, so those are all the federal jobs, period, and then within those will be all the jobs for PhDs, MDs, epidemiologists, health officials, and basically you can search on that, and that's where all the international postings will be for the CDC. So basically, you just have to apply on this usajobs.gov, and it takes about a year, or in my case, about 18 months to get through the process of the application, get the application certified, and then start to get interviews by different countries or different sites, and then again to negotiate and identify where you want to be. So I became a medical officer for the CDC. I was initially going to go to Zambia, but the Zambia position closed by the time the 18 months kind of transpired. And then there was a position in South Africa as a medical officer. And then by the time that actually occurred, the branch chief opened up. So I became the branch chief for HIV and TB for the CDC South Africa. So I did that for about 2.5 years. And then because my oldest child at that time was then about to enter high school, I wanted to come back to the United States so he could go to high school. And in South Africa, I'd moved there with 3 children. At the time, we're 6, 9, and 11. So several years later, it was time for the oldest to go to high school, and we wanted to come back to California. So now I was in another position to think about, okay, what kind of job do I want? How do I find a job? I have my credentials. I have my publications. I have my experience. I have my CV. But at this point, I wanted an academic job. And, you know, technically, I never had been a full-time academic. So I'd been a fellow. I had a voluntary faculty appointment at University of California, San Francisco, but I never had a full-time academic position in a university. So I applied to UCSF, Stanford, and UCLA because we wanted to stay in California. And I went through the interview process. I had to give what we call job talks, where you give a 45-minute presentation on an area of research, meet with the faculty. Usually it's about 1 or 2 days meeting with different faculty at the institution. And then you find out what they have to offer. So at the time in 2011-12, UCSF basically did not have much to offer me. They said, you know, you can have a desk, and that's about it. And you're kind of on your own to raise your funding, to create a program. And for me at that time, I didn't think that would be enough necessarily to be as successful as I wanted to. Stanford was very interested in laboratory science and would have required me to make a transition into running a research laboratory, which I've a lot of my work does include working with laboratorians, but I've never actually directed a laboratory on a day-to-day basis, and that didn't necessarily interest me. UCLA, though, made an offer giving me 3 years full funding at a professor's salary level, and administrative assistant time, and then startup funding of basically $25,000 a year for research for 3 years. So with a guaranteed 3-year salary, administrative support, and a little bit of research pilot money, I felt that out of those 3 offers, that was the best for me and my family. So we moved in June 2011 down to, or June through 2012, down to Los Angeles, and I've been here ever since. So now I'm in my 6th year, so I don't get any more support or guarantee from the university. My research program is 5 full-time staff, and we have ongoing NIH-funded projects in South Africa, in Peru, in Botswana, and then a variety of different clinical trials that I'm leading in the United States. So that's where I am today. So I'm going to pause there. It's 8:30, and see on this part of today's discussion if there are any additional comments or questions when I get back to the chat. All right, any?
Jeff, I was just, I wrote you a private message too. One was supposed to be a joke and one was serious. The serious one is if you want to mention that some countries have an EIS-like program that's sponsored by CDC. For example, India, Kenya, and I'm sure there are other countries as well. And the opportunities that might provide to our colleagues from low and middle income countries.
Right, thanks, Craig. So internationally, that's called FETP, or Field Epidemiology Training Program, and those are collaborations between the US CDC and the country Ministry of Health. Usually they're positioned within the communicable disease group, but not always. Depending on the relationship between the CDC and the Ministry of Health. But you're right, many countries have that FETP, and that's another great opportunity to get your foot in the door in your ministry in your country. So I'm trying to, I can't pull up the chat.
If you click chat on the bottom, move your cursor, you'll see something that says chat, and click on that, and it will show up on the left, right panel.
All right, I can stop. Oh, here we go. Okay, I had to stop the share. All right. All right, everyone's hearing well. It's true, I do bike, but anyway. USAjobs.gov, thank you, pal. And the FET program. All right, are there any other, we can open this up for a few minutes on comments on this career trajectory if people have any comments or questions.
So you mentioned some challenges. You mentioned kind of the path you took as a physician researcher on internal medicine and then followed up with infectious diseases. I know we have at least 2 surgeons on this call, Julie from UCSF and Michael from, I'm forgetting the name of the hospital, anyway, in Kenya. So we have 2 surgeons. Can you maybe talk a little bit about that?
Sure. Well, I think for surgeons in research and in global health, it's a lot more challenging because your time is often, quite limited, and your time to really engage in the process of writing grant applications, writing manuscripts, which are the currency that often researchers are evaluated on, both in their institution and as a research applicant, are limited. So, Craig, you're obviously a surgeon and an OBGYN who's been able to, create a balance in your career between, doing surgical activity, maintaining your surgical expertise, and then also being a successful researcher. So I've seen that, more often probably in OBGYN than in general surgeons. We will have Dan Dugarte, who is a pediatric surgeon. I'm going to ask him, maybe to present specifically on the surgery. But what are your thoughts on the, combination of surgery and global health research?
Yeah, I brought it up because it's something that I've been living through. You mentioned about surgical expertise. I essentially have given up doing surgery over just recently, about a year ago, because frankly, it's very difficult to keep up. I call, whether it's surgery or OBGYN, it's a tactile specialty, truly where the practice is required, I think, versus what I call medicine, a supertentorial specialty, if you will. So I think it's more challenging to keep up my clinical skills. And I think the days of the Renaissance researcher, physician, educator, people like David Eschenbach at the University of Washington, who's the chair of OBGYN, I think those days are over, just because of the requirements. If you want to lead research, if you want to be the principal investigator and lead your program, it's such a competitive environment, and we're competing against those people who are doing it full-time, PhD researchers. I think something has to give. You can't be the expert educator, surgeon, physician, and researcher. So something needs to give. On the other hand, I think there is added value. I know, Michael's project in particular, only a surgeon could do that project. Only a surgeon could conceptualize. He's studying esophageal cancer in Kenya in a location where epidemiologically the incidence is extremely high in the local population for unknown reasons. Only a surgeon could conceptualize the project that he's doing, have the resources to do what he's doing, actually do the procedures to get the biopsies and the tissue required as well. So there are many advantages. And similarly for me, in thinking about HIV acquisition back when I was living in Nairobi in the mid-90s, for most internal medicine trained colleagues, HIV acquisition stopped at the cervix. I understand, I'm sure we all do on this call, that the female reproductive system is an open system. So I was working with participants and getting biopsies from the endometrium and also doing from the fallopian tubes and so forth, looking at issues, because obviously semen and sperm obviously move beyond the cervix, and therefore HIV does as well.
And I think I've seen successful, surgical researchers as part of research teams. So in South Africa, we work very closely with James McIntyre, who is a, OBGYN, and increasingly, I think also, international research has become more complicated and more competitive, has become team research. So also the kind of older model of the individual, being the sole researcher does not really exist anymore. And certainly a lot of the research I do now, we have, biostatisticians, we have OBGYNs, we have behavior specialists, and at least the NIH increasingly is looking for, specific documented expertise in every area of your study. But it still takes, that probably a singular person to generate, the overall research question and the hypothesis, which is certainly the most difficult part. All right, now I'm going to see if I can bring up another document here, which is the Biosketch. And is this showing up, the Biosketch?
Yes, it is.
All right, but only a piece of it, right? Not the whole thing. All right. So the Biosketch, this is a very important document that you will use for the rest of your research career as you apply to different funding opportunities. This is the NIH format of the biographical sketch, but it's often used by other funding agencies as well, like the CDC, at least other U.S. funding agencies, and there may be some other modifications, and PEPFAR, there may be some other modifications for other funders. But basically, it's a very strictly controlled document, and it can be no more than 5 pages. It starts off with some basic demographic information that identifies the user. And everyone, I would think, should have an ERA Commons username if you're going to be applying for NIH-funded research or part of NIH-funded studies. Is that's required, correct, for GloCal fellows?
Yes.
Yes. Okay. All right. Well, actually, I put it in the wrong. All right. Thank you. All right. Okay. And then the one important thing is that this personal statement. So this personal statement needs to be somewhat general to describe kind of your overall experience and career. However, it also has to be specific toward the application. And reviewers want to see a combination of, you know, your kind of summary of your credentials, but they also want to see how you're going to use those credentials to support or lead this current application. So one common fault is that people do not update their personal statement for this specific application. And I would definitely recommend they do that in the personal statement. Then basically you have your positions and honors, which you can, you know, come up with a variety of different kinds of positions or honors, and honors can even include, you know, potential nominations for awards or actually receiving different awards. And then the contributions to science. So here's where you get 5 opportunities to come up with your 5 top contributions to science and provide some supportive evidence for that with the manuscripts that have been published, that you published potentially related to that. Now, as an early investigator, you may not think you have 5 contributions to science. You don't necessarily have to come up with 5. I would say you should probably have at least 2, ideally at least 3. And basically, again, these should be sometimes reordered. So the first one is most relevant to the application that you're supporting or that you're writing about. And then the others might be related to your work and might be related to the application, but often these can just be repeated and used again in different applications. And recognizing that many reviewers may not, you know, be experts at all in, you know, these specific areas that you're saying you've made a contribution, you have to tell them clearly, concretely, basically why, this is important, why syphilis is important, why your contribution about syphilis testing or syphilis epidemiology or syphilis prevention is important. Why point of care tests for STIs might be important. What's hot or new or clinically or public health wise important about molecular epidemiology of infectious diseases. Why biomedical HIV prevention is important. What is biomedical HIV prevention? There's a lot of reviewers potentially may not even know what those words specifically mean. So important to put these in language where your colleagues will understand. The next part is sometimes a little bit complicated to actually link up correctly, but it's the link to your complete list of published works in my bibliography. There are online instructions for exactly how to do that, and potentially we could provide some support on actually how to make that happen. And then in section D, you have your ongoing funded research activities. And you notice the dates ideally should be, current. So these, for me, were past June 2017, so they would be moved to past research. And then you have recently completed research, which would include things usually in the past 3 years, but not actively current. And the formats for all these are pretty similar. You have the funding agency, you have the grant number, you have the PI, you have what we call the period of performance. It may or may not include the day. Usually the month and year is fine. Some people use the actual day as well. Then you have the title, the role, and the goal. And at least at UCLA, our research administration staff go through these with a very fine-tooth comb and very detailed focus. And if there's any kind of error or missing information, they won't allow it to be submitted. That's going to vary from institution to institution. Honestly, I've never gotten anything not funded because my Biosketch was imperfectly formatted, but it does help the review process when reviewers and the project officers recognize that you're good at following directions and you're good at completing your documents according to the instructions exactly how you've been told. They generally don't like renegades who don't follow the directions, because part of science, as we know, is implementing your study and following directions. So that's the Biosketch. Comment?
I just want to add one comment. As you mentioned, almost all science projects are reliant on teams. And the PI and his team are responsible for the submission of the grants. And one thing that I've noticed, and sometimes we've had errors with our grant submissions, and I'll take the blame for that where I've been the PI, is if your co-investigators are submitting biosketches that are not formatted properly. So ideally, they're formatting them properly, but if not, it's really incumbent on you or you and your team to ensure they are. One thing I've also noticed as a grant reviewer is that sometimes people will recycle their biosketch without modifying it to fit the actual proposal being submitted. And that mainly can be done, as Jeff pointed out, through section A, which is your bio blurb, essentially. And the last 2 or 3 sentences should really be focused on how what you've done in the past is going to lead you to successfully lead or contribute towards whatever project you're proposing.
Excellent. Thank you for emphasizing that. Any other comments on the Biosketch? Okay, so I'm going to move now to, if I can figure out how to share. Okay. So now this is the UCLA academic CV guideline. Is that coming up?
Yes, it is.
Great, thank you. And this is going to vary from institution to institution. But this for UCLA, which may or may not be the same at UCSF, would be, the format that your academic CV should be in. Now, the academic CV may or may not be the same format that you use for different kind of job applications. Sometimes they want a short format. So my current academic CV is 85 pages. I'm sure Dr. Cohn's is more than 10 pages. Is, also dozens of pages, 50, 60 pages. So, sometimes for some jobs, they only want a brief CV. But basically, you're going to have your name, your title of your curriculum vitae, your personal history, your education, your licensure, your board certification, your professional experience, professional activities, honors, research grants, lectures. So, I've been maintaining my CV for, 30 years or 25 years. And this is something you will need for your whole life to be able to maintain, constantly tweak and upgrade. You don't want to be writing, an 85-page CV a week before a promotion or application for an academic position. So it's something that's a living document that you want to make sure you have, plenty of copies on different computers, on different USBs, on different, hard drives, so that, if something crashes, you can at least find maybe a version you've had in the past year. So UCLA is very specific in terms of research papers. They want to know research papers that have been peer-reviewed, and they want them in a chronological order from the oldest or the first to the newest. And then they want you to list peer-reviewed papers in press, then peer-reviewed papers that have been submitted. So, a lot of times what's in press and submitted can change on a week-to-week basis, hopefully, so that would need to be updated. Then you might have research papers that are non-peer-reviewed, again, that are published, that are in press or submitted, book chapters, letters to the editor. So importantly, at least UCLA considers letters to the editor different than a peer-reviewed research paper. Reviews, which would also be different. So while reviews are often peer-reviewed and published, it would not necessarily be considered original research, and that would be considered separate. Editorials may include editorials in the lay press, as well as editorials in academic journals. Papers in preparation, particularly for early investigators, the papers in preparation would be a good area to show ongoing intellectual activity, the diversity of your research activities, and different projects that are recently completed or even underway. Abstracts. Now, this is honestly very good at the beginning of your career to make abstracts. Personally now I probably, have 10 to 20 abstracts plus a year that I'm listed on, and I've kind of stopped maintaining that, but that's been very recent. But the abstracts are, and I'll show you on my own CV, and the abstracts are definitely a good way to, build the size and the length of the CV, but sometimes it can be difficult to maintain complete knowledge of every single abstract where it's been, but you definitely should try to. I mean, I would say teaching you guys and recommending you should try always know where your name is on any abstract that's ever been submitted and have a record of that. And that's certainly what I did very assiduously and carefully for the first 20 years of my career. Now probably a little bit less so. Before I get just to show you my CV quickly, any comments on this format? Craig, what do you do with abstracts?
I got rid of them about 15 years ago.
Okay, and
Made
why?
my life a lot simpler.
And so it just made your life simpler, easier. You did not feel, at least at this time, at that point in your career, that they were that important for your promotion or your CV. But for early investigators,
Oh no, I kept it religiously for the first probably 15 years, and then, or whatever number of years, and the last 15 or so, I pretty much since I've been at UCSF, I abandoned them. So that's 14 years ago.
okay, so that's similar.
But they're very relevant for junior faculty and investigators, but at our stage, I think it's irrelevant.
Right. Okay. So we're on the same page there with that. All right. Yeah. So I just wanted to show you quickly. We only have a couple minutes left. The actual. Let's see if I can pull this up. All right. So this is my current CV, and one thing is often institutions want it signed. I use an electronic signature. You have your format, which is your name and your address and your different appointments, your past positions, educational background degrees, clinical training experience, public health training experience, research training experience, which would include your role on different major studies as a principal investigator or a co-investigator or protocol chair. Because I do global health work and I'm on different global international groups, I just kind of created my own section called Global Health Activities, which included different international activities or projects. Teaching experience, particularly for academics, they often want to see what your different teaching roles have been and where. For mentors, it's often important to put who your prior trainees are and what your different positions are. So my mentor, King Holmes, was very detailed on that, and that was valuable, although that was not specifically required in the UCLA. Because also I've done different management positions in my career. Management trainings were relevant, particularly for public health, if you're going to be a health official or have some management responsibility. Book chapters you saw. So then peer-reviewed publications start back for me when I was in college in 1984. And then they continue in chronological order. I bold my name on the publication, so it's easier for people reviewing the curriculum vitae to see what my role was on that publication. And generally, early in my career, more commonly a first author, and then as my career matures, much more commonly a senior author, so people can see that. And then we go through, I don't know, somewhere around 400 or so publications. And then we get to different guidelines that I've been involved in, invited contributions, op-ed pieces. So mine is not exactly 100% adherent to the UCLA guideline, but it's pretty close. Then I have a section called just abstracts, reports, and presentations. So all these are the different abstracts. So, I was very good early on in the 90s, maintaining that. And then this goes on for like 30 plus pages. And as Dr. Cohn said, he no longer includes this. It's just too long and sometimes hard to keep up with. But at least I kept up with it through 2016. Journal reviewer. So this is nice to see for academic appointments, different boards and committees, awards and memberships, and then your like licensure and certification. So we're at the top of the hour. I think I'm going to stop here, open up for some questions, and then we will close the session. Any questions people want to type in? So the invited contribution would include editorials often. So often one is invited to write an editorial. So probably universities have updated that just to call it editorials. But these were actually in different kinds of journals, and probably I have other editorials that probably should go in here as well. Okay, well, I think we'll wrap this up then today. Thank you very much for participating. Please send us any comments. Okay, so I'm happy to stay on. So I spend about 20% clinical and 80% research. All right, everyone, please send your comments to Pal, and we're going to convene another one of these. Pal, do we know who is scheduled for end of November? You're on mute.
Sorry, we do not as of now.
All right, we will let you know.
Okay, thank you.
All right, bye-bye.
Bye-bye.
So, Pal, will you stay on?
Yes, yes. I'll just stop recording.